Hello, everybody, and welcome to Empire State Weekly. I'm Tim Lake in Albany. The vaping-related illness sweeping the nation has now become deadly here in New York State.
We had the first vaping death in the state of New York. A 17-year-old resident of the Bronx.
Now, Governor Cuomo says the teen was hospitalized early last month for a respiratory illness related to vaping, the youngest victim in the nationwide epidemic. The health department says they've now received well over 100 reports of severe pulmonary illness among patients using vaping products before they have become ill.
Vaping is a public health crisis. It is affecting our young people. It has been marketed to young people. Parents have to know, young people have to know, you are playing with your life when you play with this stuff.
Now, New York had issued a ban on flavored e-cigarettes and nicotine e-liquids, but with a vaping industry lawsuit now, the appeals court temporarily blocked it the day before it was supposed to go into effect. The New York State Vapor Association has now joined in the lawsuits. Meanwhile, a new Siena College poll released here in New York before the report of New York's vaping death shows that more than 3/4 of New Yorkers believe that vaping is a very serious health problem. More than 60% say they support Governor Cuomo's emergency order banning flavored vaping juice, and nearly half of New Yorkers support a complete ban of all vaping products. And joining us here now on Empire State Weekly is Albany TV reporter Peter Eliopoulos. Thank you, Peter. He's covered this week's major developments in vaping, and then, of course, our weekly contributor, WGY radio news anchor Diane Donato. And guys, unfortunately, I guess it was inevitable that we would have a vaping-related death here in New York, given our population. And then I noted that the governor almost immediately came out and called for a full ban on vaping. And then he was very graphic in his message to everyone who vapes, especially kids, about what it can do to them. And he's really taking this seriously.
Well, it seems like he's talked about this issue for several weeks, but he's kind of, from my understanding is, he's kind of conflating two different things here, and he's saying that this teen vaping issue is a huge problem, which it definitely is, which his office says, and many people are saying. But there's no evidence to suggest that this teen vaping death has to do with nicotine, and that's what the industry that he's going after completely. He's saying he wants to get rid of vaping nicotine as a whole, and a lot of people are fighting back about on that, and that's why it's stuck in the courts right now. It's because he's basically wiping out a whole industry, and you were right. He was ready for this to pounce on this opportunity.
And we should point out this was a 17-year-old in the Bronx, and I think this is the youngest in the nation.
In the nation so far.
Death has occurred.
The numbers, though, are interesting because when it comes to the people who've been sickened and the deaths that we've experienced nationwide, about 1/3 of people who are ill are under the age of 21. And not all of them are THC related. About 1/3 of them are having to do with nicotine, from the best that they can tell, because they have to look back and try to step back and see what products people were using. But there are a lot of variables going on here, so you can't blame the governor for saying this just is all very frustrating and all very difficult, not to mention the fact that we had decades now where teen nicotine use was going down, and we've seen a reverse in that trend, and that's definitely a public health concern.
Yeah.
Now, Peter, you've been to the vape shops, and in your reporting, you've talked with the vape shop owners, but they, along with their lawsuits, are saying that the state is overreaching here. They're saying that this is strictly black market THC vaping products.
Right.
But the state, whether it's the health department or the CDC, is saying, wait a minute, it's not necessarily just that. It may be both.
Well, the CDC is saying that most of these cases are, in fact, THC, but the state is really trying, and not just this state, other states as well that are trying to do this. They're pinning this on the fact that kids are among the ones getting sick, and they are usually using nicotine, but in addition to that, they're using it in combination most of the time, according to the CDC, with these black market THC cartridges. And those apparently...
Where do they get those? Where are they getting those? Online.
Yeah, okay. They say black market, but a lot of them is just online. There have been people arrested across the country for selling these things online. I think the latest one may have been in Minnesota or something like that. I could be wrong about that, but
so therefore no regulations on those.
No.
You know?
And that's, if I may, that's part of the problem here, is that the ones that are being sold, the nicotine ones, Juul for instance, those are actually regulated by the FDA. These ones that have THC or otherwise are not regulated at all, and they can put God knows what in it, and kids are smoking them, and unfortunately they're dying.
And we really should expect to see the numbers continue to rise. It's not that the word isn't getting out right now about this very current public health concern, but now the CDC is asking states to go back and look at some other cases and see if in the past some of the things that somebody might have thought was some other kind of a lung illness were basically caused by something related to vaping. So we will see the numbers rise.
Right, no, absolutely.
Interested in the symptoms of this. We've heard that it's a pulmonary issue. What do you know when you're reporting about what happens to somebody when they get sick?
Well, I can tell you from my reporting, but also I have a personal friend who fell victim to this, unfortunately. He was buying the black market THC cartridges that went into a Juul that's meant for nicotine, and he had to go to the hospital. He spent days in the hospital, 3 days in the ICU.
What was happening to him? What were his symptoms?
He was coughing up blood. He was coughing up a lot of blood, and he, like I said, he was in the ICU, had blood clots in his lungs. And you know, what some are saying is that it's because of that vitamin E acetate, the chemical that they put in that in those cartridges. It's a thickening agent.
Yeah, they're describing it as unknown mixtures of solvents, diluting agents, and flavorings.
Right.
And to this point, I guess the health department is saying, we're not really certain what these are, what it's causing. And that's perplexing to me, because typically, you know, a federal or state health department can identify something right away.
Right.
And we know they're working very hard at it. As far as symptoms, I am also under the understanding that sometimes it comes on just over a period of days, sometimes over a period of months. But right now the CDC is also looking ahead to, we have cold and flu season coming up, and there might be some confusion, but they're telling people if you're vaping, which they say, please stop if you can, that you should definitely see a doctor if you start to experience any of these kind of cough, shortness of breath, chest pain, anything like that. You might initially think it's just a cold, but it's better to get some treatment earlier on than to let it wait.
So where do we stand here in New York now? We have this legal case that was brought by producers in Buffalo, and then I guess now the vape industry, the shop owners industry, has joined them. A judge has to make a decision on this?
October 18th, I think, is the date that it's been at least, it's been put on hold, the ban at this point.
And that's simply to make, what is it, a decision about a temporary restraining order? Or
yeah, to the best of my understanding, I think it was supposed to be for 4 months. They wanted to just to give them time to figure out what's causing this, and you know, what's making people sick. And
what are you hearing, Diane, from the legislature in your news reporting? Is that this will come up in the legislative session as far as
I'm sure they'll be looking at it, but of course there's a lot of frustration in the state of New York saying, what about the feds? Why aren't the feds stepping in here? This is already in almost every state. I think Alaska might be the only state.
One that doesn't have it now.
Right. So there's also, yes, we want to do something and we're going to do something. We're not going to just wait for the feds, but there's also some frustration that if a federal ban was put in place, it would, of course, make this easier to decide what steps to take forward.
Well, it's certainly a very perplexing issue, and we'll, of course, continue to cover it here on Empire State Weekly as the numbers, unfortunately, increase, and we'll be watching for that court date on October 18th as well. Peter Eliopoulos, thank you very much for joining us here on Empire State Weekly. Well, the state is launching a new program that could help reduce suicide among students at SUNY campuses. Coming up, how a new task force will help when it comes to students' mental health. And if you have a comment or a story idea, let us know about it. You can email Empire State Weekly, and you can find us on Facebook and Twitter. Welcome back to Empire State Weekly, everyone. I'm Tim Lake in Albany. The state university system, SUNY, is taking new steps now to address mental health among its students. The SUNY Student Mental Health and Wellness Task Force will make recommendations on how to address students' mental health needs and prevent health risk like suicide at each of the 64 SUNY campuses. Now, the task force includes SUNY staff and faculty and state and national mental health experts. And joining us now here on Empire State Weekly to discuss this task force is the man charged with coordinating it, Dr. John Graham, who's the SUNY Associate Provost of Student Affairs. Thank you very much for being with us here on Empire State Weekly.
Thank you. I'm delighted to be here.
So I noticed when this task force was organized, a report from Penn State and also the New York State Suicide Prevention Report shows just a dramatic increase in the number of students now going to the counseling centers, and also, unfortunately, an increase in the number of students who say they were considering suicide over the past 10 years. So the New York State report came out. What did that find that led to this?
I can tell you this. The American Psychological Association has really been sharing a lot of key indicators, particularly from 2014 till now, about the number of students across the country, particularly young adults and adolescents, that are experiencing some measures of anxiety, depression, and suicide ideation. And so as we're keeping track of those data points, we're very concerned about how those data points align with SUNY. So the work that is taking place at Penn State and the governor's Suicide Prevention Task Force, we're sort of using that as our resource material as we continue to build our capacity on our campuses in the movement of this task force.
It's, of course, showing up in high schools as well, and it's such a difficult time of development, those young adult ages and becoming an adult. But do we have any sense of what the root of the cause is for this?
Well, some people would just tell you life. You know, college affordability is an issue, right, for some parents are struggling with their children. Then the other thing, too, is that we have a lot of children that are sort of growing up in a very complex world, and many of them are sort of struggling, not necessarily academically, but with some of their own social identities, right? How to identify themselves. And so we're looking for every measurable point that we can to help our students sort of decide who they're going to be, assist them in making those decisions, and let them know that whatever choice they make in their life, that SUNY is one of those institutions and systems that is there to support those decisions.
So, So Chancellor Johnson forms the SUNY Student Mental Health and Wellness Task Force. Give us a brief description of, and she put you in charge of coordinating it.
Yes.
Give us a brief description of the goal and what you hope to accomplish with this.
So this is very interesting. So we have an outstanding chancellor and we have a provost really that have shed a lot of light on this. And the impetus for that really comes from our board chair, Merrill Tisch, who's really concerned about student wellness from every aspect. And so as we talk about student success, we certainly cannot talk about student success unless we're dealing with the mental health challenges that students are having nationally as well as within our system. So the goal of the task force really is not to necessarily replace the work that campuses are doing, because our campuses range from geography to capacity of staff, but really to sort of augment what they're doing and help them reach the scale. Some of our campuses, especially in the North Country, some of them are having capacity issues with being able to meet with students, particularly those students who are in high school, who may be getting some interventions from high school, and they would like to have a continuation of that care when they get to college. And so some of our campuses are struggling to meet that demand. And so we're working towards that. So the goal of the task force really is to come up with a comprehensive set of recommendations for the board so that the chancellor and the board of trustees can scale those recommendations and then have high-level conversations with the office of the governor.
And you have quite a few different arenas that you're looking to form this task force, students, parents, and who are some of the other active members that you'll be seeking?
This is a really good question. So we have athletic directors involved, university police, residence life directors, vice presidents for academic affairs. We even have a few provosts there. But I got to tell you, the task force is co-chaired by two outstanding campus presidents, Dr. Deborah Stanley from SUNY Oswego and Dr. Wayne Rowley from Downstate Medical Center. So we've got the geography right with two outstanding presidents in two different parts of the state. So we feel that that's going to really bode well for us addressing all the key issues.
I'm curious what role that you anticipate parents will play, students will play for that matter as well. And then the other issue that Diane and I as parents and SUNY alum from years past are concerned about is now all the students are deeply involved with social media. And so we're wondering if that has an impact, and will that be explored by the task force?
It will be. And I got to tell you, we work very, very closely with the Student Assembly. This is a group of outstanding young men and women and older adult students that really are the ambassadors for the student population writ large across our system. We're going to be asking them some intelligent questions about social media and how they like to communicate with each other, because we can learn a lot from our students. It's not so much about those of us who are already educated. We also need to learn from our students. So this is a learning on both sides, but we're going to be able to shape some policy around this. But most importantly, we're going to be looking at destigmatizing what it means to seek help, and we want our peer students to be able to assist each other when they need
And
to.
it seems like discussions about mental health, this upcoming generation, they're much more open about it, and it's just a part of health. Are you looking into any of the mental health first aid programs that I'm seeing, where we're calling on individuals in the community to all be taking an active role in helping each other through mental health issues?
Yes, this is really a robust task force, and we're looking at working with those individuals that have direct experience of working with students and young adults at various levels. We're even considering having somebody from the faith-based community as a part of this process to really help us, scale our efforts. And we also have experts, national experts serving on the task force from the University of Maryland and the University of Michigan, two outstanding scholars, and they're going to be on a sort of a consultative basis with us in sort of making sure that what we're doing is as a part of those best practices.
So Dr. Graham, speak to us as parents. If I were to come to you as a parent of a SUNY student, I'm concerned about my child because I think there are some mental health issues. What's my role in relation to this task force that's forming?
This is very interesting. So one of the things that we would hope that our parents would do, because we have to be mindful of the FERPA law, right? We got to be mindful of the laws as it comes to our students and what we can ask them. But we want our students to
privacy issues.
Yeah.
Okay.
So we want our students to self-disclose. So to the extent that the students will be willing to self-disclose and raise his or her hand and say, I have an issue, and I need some support. We want to have that environment that's welcoming for that. And I must tell you, on the whole, SUNY is very, very good at doing that. But we got to do better, and that's why we're forming this task force, so we can really get at these nuances. When it comes to parents, we want to make sure that we're paying a special attention to our students so that they can share with us the types of relationships that they have at home, because all of the relationships are not the same. So we're going to be sort of unearthing those kinds of questions as we move forward with the work of the task force.
Parents need to let go, but they don't necessarily just want to drop them.
Right.
At the same time, and there are privacy issues.
That's right. So we're going to be mindful, but we're also going to be conscious of the role of parents. And perhaps one of the recommendations might be that we come up with something that makes really good sense for parents to review and share in and weigh in. And we may even have one of our conference calls may even address those issues.
All right. Well, listen, I wish you all the best, because I know it's a very critical issue in this day and time. As you move forward with the mental health task force at SUNY campuses around the state. And thank you very much for being with us on our program today.
Thank you so much for the opportunity. I'm delighted.
We appreciate it. We'll have you back. Well, coming up, months after devastating flooding hit New York communities once again, the international group that regulates water level on Lake Ontario now facing a legal challenge by New York State. Why Governor Cuomo says it is a last resort. Welcome back, everyone, to Empire State Weekly. I'm Tim Lake in Albany. New evidence is now showing that the limousine involved in last year's deadly crash in upstate New York may not have had brake service, as shown in a repair and inspection garage invoice. A former repair shop manager at Mavis Discount Tire, who told investigators in an interview last month that a brake master cylinder was invoiced but not installed on the limo at the time of the May 2018 inspection of the limousine. Now, that was 5 months before the limousine crash that killed 20 people near Albany. This now raises questions about how something like this could slip through the cracks, especially when it comes to DMV-registered repair shops and oversight of safety inspections on vehicles like a limousine. The criminal trial in this case is scheduled for next spring. Well, the DEC will soon be suing the International Joint Commission for negligence for this year's record flooding on Lake Ontario. Now, the suit will claim mismanagement of water levels is to blame for flooding in shoreline communities. Governor Cuomo says the IJC must compensate the state for damage to homes and businesses during floods this year and in 2017. He says it'll cost the state more than $1 billion. He says the state repeatedly called on the commission to drain flooded lakefront areas this year, but that the commission failed to do so.
They have been wholly unresponsive and have taken no action that has made the situation any better. Litigation is a last resort. We have tried everything else.
Now, this may be difficult because under its two-nation organization back in the 1940s, the IJC is supposed to be immune from lawsuits, and it has no assets of its own. Other groups are also suing, naming the U.S. and Canadian governments, though, as defendants. A commission spokesman declined to comment on the lawsuit, but the organization has said in the past that the flooding was caused by excessive rainfall, not by the new regulations on water levels on the lake. Well, we are still more than 3 weeks away from Election Day, but it's already time to start looking ahead to next year. Coming up, what changes you'll be noticing about next year's legislative session. Finally, here on Empire State Weekly, next year's legislative session will be about 2 weeks shorter and will include 4 fewer session days. The state's 2020 political calendar begins on January 8th and it ends on June 2nd. Now, it includes 57 session days for lawmakers here in Albany to pass bills in the second year of full Democratic control of the state legislature. Now, the schedule reflects a change in the state's election calendar, which now includes state and federal primary elections on the same day. That'll be June 23rd. For now, for all of us here on Empire State Weekly, I'm Tim Lake in Albany, and we'll see you right back here next week. Don't forget, though, you can watch Empire State Weekly all over New York State. Here's the full schedule of Empire State Weekly on 10 television stations across New York.